It's quite challenging because the information we have on the role of transplant are quite limited. We published back in 2010 our data from the European Lymphoma Working Party, the EBMT, and what we showed then was that you can still rescue people who have failed other therapy lines. We have now, and also the other thing we have shown at that point is that the earlier you go, the better the outcome will be. What is the role? With the advances in therapies for Waldenstrom's, we know that we have more conventional therapies that can achieve deep responses, and also the duration of response is quite good as well. So the transplantation option is falling in later stage of the treatment pathway of the Waldenstrom's. But what we have shown in our updated report from the EBMT is that still these people who have the transplant after the third line still can be rescued. As to who should be eligible, apart from the characteristics of the disease failing previous 2 or 3 therapy lines, is about patients who are fit and eligible for transplantation as per any other low-grade lymphoma.